Hi, Polly.
Hi, Nurse Practitioner Robin.
How's it going today?
It's going. I missed you.
Oh, you missed me? Wow.
Yeah.
Where you been?
Well, I visited Dr. Dontcare last week.
Oh, you did?
Do
Yeah,
you know?
I've heard of him. Yeah. I've gotten a few
That's
of his
a girl.
patients. Her.
Yeah,
Yes.
I know.
Yeah.
Whatever.
Yeah.
But yeah, I just went to her for my symptoms for menopause, my menopause symptoms and hormone issues, and I didn't really love what she wanted to do.
Oh, really?
Yeah, I went through this whole list and she gave me all kinds of stuff. So I was wondering what your opinion was.
Okay. What kind of things do you have going on?
Well, I told her I was kind of depressed and irritable. She gave me Prozac, which I did not want to take.
That comes with so many side effects. Yeah.
I know,
Wow.
that's what I mean.
Yeah.
And then I also told her that I was having trouble sleeping and that I was on the alcohol, you know, and she told me to take a sleep aid on top of it.
That's concerning.
Yeah, I
very
tried it and I
concerning.
was zonked
Hung over
out.
the next day?
Oh
Yeah.
my gosh,
Yeah.
big time. And then for my headaches, she said ibuprofen.
Oh, no.
For my crying, she basically gave me tissues.
Oh, okay. That sounds pretty helpful.
Yeah. And then for my acne and my whiskers, she didn't really do anything. Just told me to kind of use an acne cream.
Okay.
Yeah. My pharmaceutical counter got kind of big.
You did?
Yeah.
Wow. Okay. Yeah.
Yeah. And then for my acid reflux, she told me Tums.
Oh gosh, that's such a poor form of calcium to begin with, you know. So
I ain't
and
about
that can
that
increase
life.
your constipation even more.
Yeah.
Yeah.
Seems like it, because I'm already constipated. And really, she told me to take a laxative, which I was on the toilet all day.
Oh man.
Yeah. And for my cravings, she basically told me to have more self-control.
Oh gosh, make you feel bad about yourself. It sounds like.
Yes.
Wow.
Yes, it's very bad. Joint pain, again, the ibuprofen. For my hot flashes, she gave me a fan and a cold pack.
Oh.
Yeah. Oh.
Could be helpful, I guess,
I
but
guess so.
not inconspicuous, though,
No,
right?
no, certainly not.
Oh my word.
And then I'm having heavy periods and urinary leakage, and she just gave me this huge, like, granny pad.
Oh man.
Yeah.
How
And
comfortable would that be?
no,
Wow.
not at all.
Yeah.
I'll tell you from personal experience. And as far as sexy time, you know, I've been having, it's been painful, and she really didn't have a whole lot to offer me. And as far as helping to increase the sensitivity down there, she gave me this cream, but it's not
really
doing,
helping.
It's not really doing
Okay.
the job.
All right.
Yeah.
Well, you know, it sounds like you have a lot of symptoms going on. You have about 15 things listed here, so that's a lot of things going on, right?
That's what I'm saying.
But you know, all these things are not, they're all related, and so a lot of this can be taken care of if we just balance your hormones.
Okay.
So we could probably accomplish that with just a couple of medications that are plant-based rather than pharmaceutical things. We could
Great.
get to the root cause. Would that sound a little better to you?
That sounds absolutely fantastic.
So one thing we might want to do, and it sounds like you might have a low progesterone level, and because low progesterone can affect your mood, your sleep, your cycles, all of that. And so, I mean, that knocks off quite a few things off your list here. And so there's progesterone receptors in your brain and in your uterus. And so you can start to see a low progesterone can really cause some of those symptoms that you mentioned.
Yeah, that makes sense.
So we can check for a progesterone deficiency by doing a saliva test. And you just spit in a tube and it measures your estrogen, your progesterone, your testosterone, your DHEA, and a cortisol level.
I'll probably need more specific instructions, so maybe at a different appointment.
Yeah, sure.
Yeah.
Yeah, so your progesterone will go down first when you start going through some of the hormonal change, and the estrogen usually stays good for quite a while. So that would take care of multiple of those things. The other thing is if your testosterone is low, we could give you a little bit to apply to the area.
Oh.
And that might liven things up a little bit. And DHEA may also increase your sex drive too. So
Okay,
that would
great.
help with that. Yeah.
Fantastic.
I think some of your joint pain typically may get a little bit better once you start sleeping better.
Oh.
And I think even your food cravings, because you're just so tired, you're just looking for stuff to eat to make you feel better. So if we could get you sleeping better, and again, that progesterone you use it at night, it's very soothing, it's an antidepressant, calming, that would work really well for you.
Oh, good.
Now, let's see
I'll
what
try
else.
anything at this point, you know.
And then as far as the painful sex, they actually make a plant-based estrogen, they call it troche, and you just put it in vaginally, and it'll thicken the tissue up again so they don't feel like it's tissue paper tearing.
That's so funny. She had tissue paper.
Oh, really?
Oh,
okay, yeah. That's what it feels like, yeah. So
great.
So it would thicken the tissue up again and moisturize things so it wouldn't be so uncomfortable and you wouldn't need any of those over-the-counter gels and things that they sell.
Shut your mouth.
Yeah.
I mean, don't.
Oh,
don't.
Okay.
Thank you.
You're
this
welcome.
is going to be great. It
Yeah,
like
so I think a lot of these things, other things we could get into more later if you're still continuing to have belly issues. You might want to look at your diet, and the constipation. Probably we'll get better with hormones, but we can also address it with your diet. That would be better for you than another medication, I think.
Yes.
Yeah.
Please.
Okay, well, great. Well, maybe we'll have you come in, or I'll have my nurse come in and explain to you how to use the saliva test.
Sure.
Yeah.
Yeah. She seems like a nice gal. Anyway, I guess that's it.
Yeah, I think that's it.
Okay.
Yeah, for the most part. I think, again, the acne, the whiskers, all that probably are from the testosterone getting an upper hand.
Okay.
If we give you some progesterone balances hormones out, it'll sort of level the playing field a little bit, so some of the symptoms get better too.
Okay.
But as usual, we can balance your hormones with natural hormones, but we'll also talk about the stress reduction, which we've done, good sleep, and good bowel function. So that's all part of it as well.
Yeah.
But not more medication. That's not the idea.
No. This has been quite a journey so far.
Yeah, so hopefully that sounds better to you than what Dr. I Don't Care had in mind.
Much better, much better. Thank you, Robin.
You're welcome. Have a good day, Polly. Bye.
Well, that is that. Nurse Practitioner Robin addressed all the things that Dr. Don't Care addressed last week. Mm-hmm. She addressed them in a way that we would address them.
Right, yes. We're looking for the root cause.
Functional medicine perspective, as well as integrating natural and more conventional methods.
Trying to use more plant-based hormones than conventional ones that you typically get offered. And no birth control pill offerings here. No.
So, if you like what you hear, give our Facebook page a like, subscribe to our YouTube channel, give us a call, and as always, we'll see you next week.
Take care.
Thank you.
Bye.